Hello, I'm Professor Andrew MacLeod, and this is the 14th and probably last in the series of podcasts I've done for the Global Thinkers Forum. So let's wrap up where we are with the coronavirus and where we need to go into the future. Let me throw one piece of data at you for your consideration. And the data is this. In Australia, the average age of people dying with the coronavirus exceeds average life expectancy. It's something similar in the United Kingdom. Now let me be clear on what I'm saying and what I'm not saying just now. Firstly, I'm not saying let's just let the old people die. But I'm not saying let's just continue the way we're going now. I'm putting up one piece of data out and saying, what does this mean for our analysis? Now the first few months of the coronavirus, we've acted globally at a sort of level of panic. Here we have this new lethality risk to the human population, and we don't know how to handle it. We've slammed the brakes on our economy, we've slowed international travel, we've put additional resources into the health system, and we are trying to figure out how to treat this virus. All of those responses are understandable, and all of those responses are good. Certainly at the beginning of the outbreak, we had no idea who was at risk. As far as we knew, everybody was at risk. But now we see it really is only one demographic, and a demographic that have already lived a full life. Yes, there are some people under the age of 60 or under the age of 70 that have died of the coronavirus, almost always with underlying health conditions. Now, I'm not being unsympathetic to that, but I do make this point. Our current response is clocking up billions of dollars in government debt. It is also putting an enormous number of people back into absolute poverty. According to the UN, perhaps 100 million people have already gone back into absolute poverty, with the corresponding deaths that result because of the coronavirus response. We've also seen a massive decrease in measles vaccinations and polio vaccinations, particularly because of social distancing rules, with those diseases coming back and the corresponding deaths. So this is not an argument about economy versus deaths. It's about an argument of alternative economic responses and alternative levels of deaths and who is doing the dying. It is true, take the emotion out of it for a moment, that the young people will, by a vast majority, be paying for this virus to protect, in the vast majority, elderly. Now, my generation, I'm about 53, I don't have a dog in this fight. The cost is going to be largely borne by the generation after me, and the benefit in terms of lives is received by the generation before me. So I'm just raising the question, and I say this, if your immediate emotional response is no, we must let the old people live, or your immediate emotional response is we should not put this burden on the young people, I ask you to step back from your immediate emotional response and ask this. Now that we know who this virus targets mostly, not universally, but mostly, and now we've got better ideas of how to treat and will continue to get better ideas for how to treat this virus, what really is the best policy response moving forward? And that's just what I want you to think about. I don't have a firm opinion on this yet. But if the average age of people dying with coronavirus, at least in Australia and the UK, is at or exceeds average life expectancy, the question then becomes, how do we continue to evolve a society with coronavirus as an ongoing lethality threat? Maybe what it says is on increased social distancing of our older generation. But then, if you're a libertarian, how can you impose a government regulation on when a grandparent can see a grandchild? If you're 90 years old and you've had a good innings and you want to give your grandchild just one last hug, who is it in the government that can say to that old person, no, you're not, even if there is an increased risk? Maybe there is social isolation of the old people with information, and if an old person decides that they want to take that risk, let them do so. There are many ethical dilemmas that cross and over in this debate, but I do want us to now start thinking logically as much as we can. There are instinctive and emotional responses to that piece of data. I ask you to step back from your emotional response, try to think logically, and let's ask the question. We now know more about this virus. How do we step forward and move forward together? I'm Professor Andrew MacLeod. please be in touch. Andrew@macleod.com, MACLEOD, is my email. Thank you for listening.